All right, welcome to the second Faculty of Medicine, to our Open Door Day. I'm really glad to see so many students here in person. I wasn't expecting this many. My name is Cristina Lehto. I'm a sixth-year student in our faculty, and I will, at the end of this presentation, tell you a little bit about how is the studying in this faculty. But I would like to firstly start and introduce our dean, Professor Babiuk, and he's going to tell you shortly how is it studying in our faculty.
So good afternoon. It's my great pleasure to be able to introduce to welcome you here and tell you a few words about our faculty, about our approach to the teaching, what we understand under the modern teaching of medicine, and maybe something about some atmosphere and of philosophy, what we are doing and what we would like to achieve. So first welcome once more. Welcome on our open day. We are happy that you are prepared to offer your Saturday time for our open day. And I think those who finally decide to sit for entrance examination and will succeed and will be the students of our faculty, those have in front of them a very interesting, maybe for some of you, fascinating journey, which is demonstrated on these 4 pictures. So you will have 3 years of preclinical studies, of preclinical disciplines, which we provide in our campus on Plzeňská Street. I will talk about it. If you proceed after 3 years, you will be able to continue with your clinical studies in the individual departments of in the hospital Motol, where we are now. And of course, it all will be associated with some students' life, and there will be some official activities, like this is the ball of our medical faculty, and there are also, of course, several unofficial events where I'm not fully informed usually, which is better, of course. And this is our symbol. This is pelican. By the way, this one is 5 years old now today, so we celebrate his birthday today. And this is our symbol. The pelican was, since the medieval ages, the symbol of medical faculties, and we even adopted the pelican in the Prague Zoo. So we really love our pelican and pelicans at all. So, and if you will succeed during your studies, you will be able to enjoy the celebration ceremony in the historical aula, which is really beautiful. And I had a chance to visit some of ceremonies in other universities all over the world, and I'm able to say this on Charles University is one of the most beautiful. So, and we are definitely, our faculty is the part of Charles University. It is the oldest university in to the north from Alps, which was founded in 1348, and it brings us some traditions, some stability, and of course, you will probably visit the historical buildings of Charles University very rarely, maybe for the immatriculation ceremony on the beginning and for the graduation ceremony on the end, but still the university and its traditions are here. But you will, of course, spend more time in the faculty campus. This is, I spoke about it already, it is the very modern building which was completed 2 years ago, or less than 2 years ago, with very modern equipment. There is the modernest Department of Anatomy in Czech Republic, and also the modern teaching facilities for all other disciplines. And there is some place inside and outside which is ready for several students' activities, as I already mentioned. We are very proud that we may cooperate with Motol Hospital, which makes some background for us. It is the largest hospital in Czech Republic and the most complex hospital in Czech Republic. And even it is one of the largest hospitals in Europe. You see 2,500 beds and practically all specialties in medicine you can imagine. And it has its adult part, which is from here on the left side, and the pediatric part, which is on the right side. And particularly the pediatric part is really very unique, also in the European context. So we are very happy that we have the Motol Hospital as our basis, and comparing to the size of the faculty, it is a great advantage because we are the smallest, concerning the number of students, the smallest faculty between the 3 medical faculties within Prague. So, this can give us a chance of very individual approach to our students. They can participate on several clinical activities, and I hope it is very useful for their future career. But it is not only about Motol Hospital. We try to be international school. 200 of our students can go abroad in several programs. Here you see the countries which they visited, and this is true also for our international students. So definitely we try to be international and give you a chance to see also medicine in other countries. So why should you choose our faculty? Here are 3 reasons. First, we make a fair admission examination. We hope that using also the oral exam, we can already start to make a very close contact with our future students. We are friendly. I hope we will be able to persuade you about this today. We have new and modern curriculum. What is curriculum? Professor Zámenčík will explain you what is curriculum. You know, the point is the doctors sometimes are using words which are very complicated, you know. So it is... they sometimes try to use complicated terms, maybe because they don't know exactly what they are talking about. But this is not our situation, so we will talk about curriculum, and we know exactly what it means. And the final reason is that we have the clinical practice in the excellent and exceptional Motol Hospital, and our graduates can find the future career and success in all disciplines you can imagine. The studying of medicine gives you a very particular knowledge on the end of the study comparing to several other studies, and I am not aware about any unemployed doctor, not only in Czech Republic but even in Europe. You can theoretically become the general physician, you can become the specialist in the clinical department, you can become the scientist, and if you like, you can be even the director of the hospital or whatever, and we have our graduates in all of these areas. So our role is just to prepare you as a successful doctors and good doctors and give you an opportunity and enough information to do really a good choice of your future career. So once more welcome in our faculty. We are very happy that you are here, and I give the microphone to my colleagues who will continue with explanations. So Christina will continue.
Thank you. Thank you very much. So next we're going to move to the curriculum that we talked about, and I have the honor to give the microphone to the Professor Zámečník now first.
Thank you. Hello, welcome to Second Faculty of Medicine. My name is Zámečník and I'm Professor of Pathology. I will teach you pathology in the third year, but I'm also Vice Dean for Study Affairs, so I will talk about curriculum, this magic word. You can see that this magic word has this explanation, which is also not that easy. So to make it easy, curriculum is schedule. The schedule of your study is the plan, the pathway you go through the faculty. And we have changed it last years. And we changed it because everything is changing in the world, and you know that there is a progress in knowledge, there is a progress in modern technologies, and also there is evolving demands in handling information and data. You know, information, disinformation, and so on. So we decided to change it so that you can just approach all the challenges that will come in the future for you as a doctor, and you will just practice medicine in 10 years. So we will make it flexible enough for you to be the best doctor ever. So that's the reason why we changed it, and what's the result? This is the result. This is our curriculum, which is a tree, which has roots, which are broad, and roots are you, because you are coming from different countries, from different schools, and then we need to unify it into one strong and solid trunk, and then we can have a widely branched crown, which is the clinical medicine, which you will study 2-3 years, meaning from 4th to 6th year of study. So this is how it looks. The first 3 years is about uniforming the knowledge, and this educational core will bring you lots of information, but also some basic skills. So what will you know at the half of the study? What will you know in the after the first 3 years? Theoretical basis, you will know about the structure and function of human body, and also you will learn about diseases and disorders, how they develop, why they develop, and the only way how to treat diseases and your patients is to understand the disease. So this is the theoretical basis you will get in the first 3 years. But you see that during this first 3 years you also get some basic skills. You will know basic nursing care. This is very important, and also communication with patients. You will learn Czech, so you can also learn how to speak to patients in Czech language, which is not easy, but it's funny. You will recognize some clinical manifestations of disorders, and you also will perform some clinical examination, and you will understand basic clinical examination methods like X-ray examination, MRI, and so on. This everything you will meet during the first 3 years of your study, and also you will deal with the ethical principles of medicine. This is also important, with psychology of patients, and you also will have some bioinformatics skills, because the work with data and information is very important in modern medicine. First 3 years will be so-called semestral studies, meaning that you will have semester, then period for examination, and next semester and examination period and holidays. This will be 3 years, and this is how it looks like. It looks complicated, but it's not. We have different lines, and I will introduce you the lines we have in the curriculum in the first 3 years. Of course, the most important for you will be the main medical line or section, in which you will meet important subjects like anatomy, histology, embryology, and also in the second and third year you will see physiology and biochemistry, meaning that is how it works, and you will also study pathology and pathological physiology, so how it doesn't work, meaning this is the study about disorders. What is important that even from the first day at the faculty, you will meet patients. You will go to patients, and we have practical line in which will teach you many important skills like nursing. You will be informed about first aid. You also will have the clinical propedeutics, which is the introduction into clinical medicine, which is how to examine the patient and EEG and so on. So this is everything. And what's also important is professional communication, which is top question of modern medicine, and this is the practical line. Then we have the ethical line, which is also important because in medicine sometimes things are going not easily, and you will learn how to formulate opinions. You will try to build consensus. You will learn about psychology, psychosomatics, and also you will deal with ethically questionable questionable topics. So this will not be not only like lectures, but you will also have practical and some practical skills from this important branch of medicine. Then we have the bioinformatical line. So these are 3 subjects in which you will, in the first year, you will deal with medical information and databases. So it's very important. In second year, you will deal with principles of scientific work, which is also important. You will not be pressed to be like scientist, but you will need how to use the scientific information, not only in textbooks, but also in publications. So this is also a very important topic. And then in the third year, you will be informed about clinical trial design and about epidemiology, biostatistics, and about evidence-based medicine. So this is also a very important line. Then we have terminology. Of course, you will have to learn some Latin and some terminology because as our dean said, we love to use words that nobody understands, so we will learn it also. So this is the first 3 years. Then we have the 4th to 6th year, which is like the crown, and everything will be integrated. And this is what students love. And the major change will be that you will be teaching in the weekly blocks. So these will be no more semesters, but you have blocks, like 3 weeks in neurology, 2 weeks in internal medicine, and so on and so on. And you will go through all the hospital, and you will see all the clinical departments of our faculty. And also you will see the simulation medicine, which is a very, very important part of practical skills training. And we also allow some certain specialization during these years. If you like surgery, you can go to some hobby groups for surgery, and we have also optional subjects for surgery and so on. So you can just do what would you like, or you can just try anything so that you see that you don't like it. So also important to do it during the studies, not after the graduation. So this is how it looks like. You go I will not read all the departments, but you will go through everything. What's important that we have some practical skills. During summer, you can visit some hospitals outside Motol or outside Czech Republic to see how the practical medicine looks like. And we also provide some subjects like medical skills training. This is 2 weeks. You will go to the hospital. You will have your own doctor, and you will go to the hospital to work with him 2 weeks. You will see how it works in reality, not in seminary or in classes, but also in reality. And in 6th year, we have clinical skills training. This 8 weeks. 8 weeks with your choice. You will choose any subject or any clinical branch. You will get your doctor, and you will make 8 weeks there. And I think it's good for you to choose the proper clinical branch for you after graduation. So this is our curriculum. We also have optional subjects. We have like tens of optional subjects, so you can choose. Of course, in medicine, you have you know what you will study, because it's important that you have anatomy and then pathology and physiology. You cannot change it. But of course, we have some place for some optional subjects, so you can choose what you like. If you like filming, you can go to filming. If you like surgery, you can go to surgery, and so on. So this is curriculum, which in first years is about basic practical skills and theoretical information. In 4th to 6th year, it's about integration and about clinical practice. So this is the tree of the second Faculty of Medicine, and thank you for your attention.
Thank you so much. So for the next speaker, we have docent Průhova coming to tell you about the clinical practices.
Thank you very much. You are very welcome here to learn about the clinical studies at our faculty. The clinical studies, as it was told by Professor Zámečník, are organized as a block teaching of all branches of medicine in the 4th, 5th, and 6th years of your studies. Firstly, we start with the simulation medicine method for training everything. So we start with a training of the virtual patient, and then you will learn all skills which are necessary just to survive your patient here in the training room. And you will continue with the simulation medicine of urgent medicine on the Department of Anesthesiology and Intensive Care Medicine, where there are real situation of intensive care, and then the students can train how it will be safe to manage all these things about these virtual patients. But then we continue with the real patients in all branches of our hospital. And here you can see that students can visit the surgical theaters of 11 surgical specialties, which is quite a lot, because this is not only the general medicine, but also like a special branches like pediatric cardiac surgery or the operation under microscope in the department of neurosurgery. So it depends which branch you would like to be more informed, and you can really look more deeply in that branch. On the surgical theaters, the students are a part of a surgical team, so they can assist to the operator and or can see very deeply how he's doing. It's also possible to learn the endoscopic and robotic operations. Here are the students training on the endoscopic operation, and a student trying to use the robotic system Da Vinci on the Robotic Olympiad, where it's possible to try how it is to use such a method of future medicine. Here in Motol Hospital is the medicine really from beginning of the life. For example, here is possible to see the in vitro fertilization, then the delivery of a newborn and the care of a very, very small children in the newborn department. And then you can continue with a very comprehensive teaching of pediatrics, because we have here all branches of pediatric medicine, and the students can be in touch in such a children and communicate with them, communicate with their parents. That's why you need to learn some words in Czech, and then you can really be informed or study their stories, which sometimes start really with a very, very serious diagnosis, and most of them continue to happy end, where the children are healthy and they can continue their healthy life. We have here also very good teaching in all branches of internal medicine. Here you can see, for example, doctors in Department of Cardiology with some intervention cardiology methods, not teaching, but treating, for example, the cardiac attack, or all the branches of internal medicine, for example, here in a medical, in intensive care unit, where all these metabolic problems can be solved. The specialty of studying in our faculty are all these clinical internships, as was told in not only in our curriculum, but also as a 4 summer clinical internships, where the students can choose where they want to undertake their internship. So they can choose different branches, they can choose also different places where they want to go. And we are very happy if international students go for this internship outside hospital, Motol hospital, outside the Czech Republic. They can do it in their home country and compare the experiences from your country to teaching here in our country, or you can go to completely different country and be in a contact with other international students and make new friendships and experience. If you would like to learn more about these possibilities, we have also short stories from our students who were on such internships, and you can read about their experiences and how they were happy that they can contact a different country and different people. So we are really looking forward to you, and I hope that you will come to study with us.
Thank you very much. And now to the coordinator of international students, Petra Fabingera. She'll tell you a little bit about the studying here as well.
Okay, so good afternoon again. It's my pleasure to see you here. And now we will talk about first step to become a doctor, the entrance exam. Okay, so the entrance exam has two steps. First one is the written test. Second one is the oral interview with a committee. So written test has 75 questions, biology, physics, chemistry, and logic. And it's a little bit tricky because there will be 4 answers given, and you have to choose the correct one. But the problem is that the correct one can be 1, or 2, or 3, or 4. And your answer must be completely correct when you want to earn points. Of course, logically, logic has just 1 correct answer. You can get 3 points per each question, which means 225 points altogether. 90 minutes is the time where usually our applicants are able to complete the test. So this is not like too much stressful. And if you want to get familiar with the questions or how they can look like, you can look at our faculty website, part for applicants, and you will find some model questions. So you can see if it's not necessary to study so much before the exam for you, or if you should start preparation more intensively. When you are successful in the written part, which means that you have around 50% of correct answers, you continue to the oral interview. Oral interview is nothing you have to be too much scared of. It's you will meet 3 faculty members. You will draw 1 paper on the table with 2 questions. Questions are usually related to ethical problems related to medicine, or something which recently happened on the medicine field. And it's not focused on your knowledge. You have not to say the list of anything. It's about your ability to present your opinion, to answer our questions, to discuss the topic, and you can get up to 60 points. So at the end of the exam, both parts are added together, and when you meet our criteria, when you have enough points, you are admitted. The great thing is that you will know the result at the end of the exam day. So you are leaving the exam with the paper that you are our student for the next academic year. So no more waiting, no more weeks being nervous or something like this. No, you know it in the afternoon. It will be demanding day, long day, but hopefully also successful day. There is also the option to be not to be obliged to go through the entrance exam. You can see some basic information about it. More information is available on the faculty website, and also our study department is ready to answer the questions you can have about this topic. The good thing is that everyone who meets our criteria is admitted. We usually have around 90 students in the first year, but if there are more successful applicants, they will be accommodated as well. It's our problem, not your problem. And the exam dates. We have 2 entrance exams here in Prague. One in May, one in June. This will be probably very, more comfortable for you when you are already doing some school in Prague or some preparatory course in the Czech Republic. But there will be also some entrance exams conducted abroad. But in this case, it's necessary to check our website, the list of the agencies we cooperate with, and look directly at the agency website where they offer some exam dates, let's say in Israel, Dubai, Portugal, and other places. Also, I think India this year, if I'm correct. As I said, our website has more information, so look at it, and if there is something which you cannot find, any information you would like to know, just contact the study department or contact me. Okay, thank you very much for your attention.
I'm going to tell you from the perspective of the student. Actually, fun fact, that's my sister inside the Pelican. She did not enjoy it a lot. It was very hot inside. So, how is it studying at the second faculty of medicine in Prague? Shortly, I promise, this is the most text you're going to see on my presentation. My name is Kristina. I'm a 26-year-old student, and I was born in Finland, but my mom is Czech, so I speak fluently Czech. And I'm a 6th-year student here, and I currently just have 3 more exams to finish my school. Okay. So I decided to take a bit of a different approach to how to explain how it is. So obviously, I can't lie to you. It's going to be hard. Medicine is not going to be easy, but if you're motivated, it is doable, and I'm still here, so anyone can do it. On the left up, you can see me in the first year, very happy. It was after a dissection exam, so I was very, very happy that I passed it. So the first 3 years were, as we already talked about, more like a theoretical, and we were sitting a lot in front of our books and just trying to learn a lot. Then I would say, for me at least, from 3rd year onwards, the fun started and we got to do things. So you can see a lot of surgical pictures. We are able to go to surgeries. We are able to assist on a surgery. On Friday, I was assisting in a hysterectomy. And you can see we can do surgical procedures ourselves, trying it on an endoscopies. Here I was doing a night shift in a radiology department, and I was staying there until 10, 12 p.m. We were going through all the emergencies that were admitted that night. And here actually me after a pediatric state exam. That was a great, happy moment that our first state exam was over. So that's like generally, I would say it is, from my perspective, the first 3 years were hardest, but not because of the fact that it was the hardest thing in medical school, but because you don't know how to study in the first 3 years. After some time and you're able to understand a bit better how are your studying ways, and in the last 3 years you're just able to actually enjoy and proceed in your studies. I wanted to also point out all of these pictures are taken by me, and I'm not a photographer. Prague is beautiful. There's so many things you can do in Prague. There's beautiful cafes, there's beautiful restaurants. There's so much activity you can do. On Fridays you can go party if you want, if you have time. Remember to study. But if you have time, you can go and have some drinks with your friends as well. There's beautiful architecture, there's beautiful culture, so really enjoy the opportunity that you can study in this beautiful city for sure. There's a lot of opportunities outside of our normal curriculum. What I have been doing as my extracurricular activities, on the left side you can see there's our AIMS, our Association for International Students. So we have our own association for international students, which are helping students in different problems. We are organizing activities. We are doing this Pelican Buddy program where you get an upper year student who's going to be taking care of anything you need, or if you have some troubles, you can ask them. As I said, we have some activities, we have events, we have actually our academic event vice president here also present today, organizing suturing workshops, organizing some nursing workshops. So it's really, really important to have this for our international students as well. Then my other extracurricular activities that I do, I had a chance to be a part of this Pelicast, our own podcast, and there are actually 3 episodes that are completely in English. So if you feel like you want to hear something about our studies here, there is a lot of interesting information, and it's all in English, as I said. Then I was also part of Academic Senate in our faculty, from the student council, obviously, and that's very interesting, and it was an important opportunity for me to see also from the internal side how is the faculty led, and it was an important task for me to be able to speak for our international students in this council. On the left, that's future. On May 18th of 2024, we're going to be holding a TEDx event here in our faculty. So that's a big thing for us, and we're hoping that we're going to get a full hall of people following us and come see this great event. My opportunities abroad. So these are all of my internships in the summers. From 3rd year onwards. You can see here, I did all of my internships in Finland. In Finland, after 4th year, you're able to work as a doctor. So you can see here on the left side, this was me in the summer, having my own room, doing the doctor work. So it is possible to do doctor work even during your studies. It depends, of course, on the country where you're coming from. Here I'm suturing a tomato. Don't worry, I did not suture any live beings yet, so you don't have to be scared of that. And yeah, those are all of my experiences from the summers. Here, just thank you for your attention, but here you can see we have some Instagram and social medias which you can go and take a picture of and go follow us. There's some important information for the international students, and there's the TEDx webpage as well for you. So thank you for your attention. If you have any questions, we're going to still be here. And we're going to take you to the anatomy department in Plzeňská after this. So please follow these beautiful signs, and we're going to take you there. Thank you.